A murmur is an abnormal heart sound which can be due to normal blood flow through abnormal heart valve or abnormal blood flow through normal heart valve. It can be heard during systole or during diastole or throughout the whole cardiac cycle. So it can be classified as systolic murmur, diastolic murmur, or continuous murmur. Now, what about the valve? If the valve is too narrow, we call it stenosis, and this causes obstructed blood flow through that valve. And if the valve is not functioning properly, if it is too leaky, then there will be backflow, and we call it regurgitation. And in case of the left side of the heart, there is mitral valve and there is aortic valve. So in case of mitral valve, there can be mitral stenosis when the mitral valve is too narrow, and there can be mitral regurgitation when there is backflow in the mitral valve. And in case of aortic valve, there can be aortic stenosis and aortic regurgitation. Now, the valve pathology and the type of murmur. What is what? So remember this: mitral stenosis has diastolic murmur. MS has MD, like the post-graduation degrees. MS, MD. Mitral stenosis has mid diastolic murmur. For now, just remember diastolic. Mitral stenosis, diastolic murmur. Now, change the stenosis for regurgitation. See here, mitral stenosis becomes mitral regurgitation. So you change the diastolic to systolic. And then again, if you change the mitral for aortic, then mitral stenosis becomes aortic stenosis, which again diastolic became systolic. And if you change both the words, mitral stenosis, mitral becomes aortic, stenosis becomes regurgitation, then diastolic turn twice, then again diastolic. So 4 type of murmur we can get here. Mitral stenosis has diastolic murmur, change the stenosis to regurgitation. Mitral regurgitation has systolic murmur. Then mitral stenosis, change the mitral aortic stenosis, this again has systolic murmur. Then change again, aortic stenosis becomes aortic regurgitation, which again becomes diastolic murmur. In mitral valve, mitral stenosis, mid diastolic murmur. Mitral regurgitation, pan-systolic murmur. Then in aortic valve, aortic stenosis, ejection systolic murmur. Aortic regurgitation, it has early diastolic murmur. There are other murmurs in patent ductus arteriosus, in arteriovenous fistula. We can hear continuous murmur.